AM 850 WTAR. It is our hour with Eggleston Services. Paul Atkinson here in the studio. He's the president, CEO of Eggleston Services. EgglestonServices.org. That's their website. And their phone number is 858-8011. That's 858-8011. Creating education, training, and employment opportunities at home, at work, and at play. That is their mission. Paul, we've got another guest coming up right now.
That we do. We have Chip Dodd on the phone. And Chip, how are you doing?
I'm doing very well. How are you?
I'm doing good. Sorry to keep you on hold, but I'm glad you're able to join us for a few minutes. I think I guess, did you read the paper yesterday morning?
Yes. We've been involved in a number of different papers and articles that have come out recently.
Well, and Chip, maybe you could set the stage a little bit. What we want to talk about for a few minutes is what came out in the paper yesterday was a Department of Justice investigation of the service delivery system, primarily in institutions for people with intellectual disabilities here in Virginia. So
yes, this has, I guess, been an ongoing debate since 2008 when the Department of Justice first began their investigation at Central Virginia Training Center in Lynchburg, and we were a part of the ending of that investigation because we do operate services in the Lynchburg area, and they wanted to identify what community capacity was available, what are the skill sets of different models such as sponsored residential group homes, day support, vocational programs. And they really wanted to look and see if the needs of the individuals that are in the institutional system or training centers could be served in the community with the same or better level of care and quality, with a more integrated setting where they can actually interact with peers that are not disabled.
And Chip, right now, just to frame it, in Virginia, right now, we have about 1,100 individuals that are adults that live in state training centers.
Yes, that's close. They are very slowly downsizing, but that sounds accurate.
But I think Virginia is a little bit out of step and kind of unique in the country in that they still institutionalize people in Virginia. They haven't closed the doors completely. So
now we are actually, I think we're number 10 largest institution census. There's other states. I think there's 13 in our country that have completely done away with all state-operated institutions. And I love Virginia, and I think we're a great state and Commonwealth. But when you see other states, we have West Virginia, Maine, Minnesota, Indiana, Oregon, Michigan. These are all states that have figured it out. And for Virginia to be being cited by the Federal Department of Justice on human rights violations and we're violating the civil rights of our folks and our citizens with disabilities. It's frankly embarrassing that we're even having this discussion in 2010, 2011.
And Chip, I know you were involved heavily in the issue of efforts to try to close Southeastern Virginia Training Center in Chesapeake.
Well, let me correct you on that.
Okay.
I was actually asked to be on an advisory committee, just to offer a private provider
So
perspective.
maybe they really didn't involve you. They just asked you to be an advisor.
Right. Well, I guess my involvement in that is that there are problems in both systems, in community versus institutional, and there's great things that happen in both systems. There's a lot of fear and uncertainty, and on the sides of the families that have loved ones that are in institutions, they haven't been really educated on the community. They've heard horror stories, just like in the community we hear horror stories about institutions. I was there basically to provide a perspective on what's the community, what is our capability, what are our flaws, and where do we need help. And the Department of Justice letter, their findings, very clearly outline that there are problems in the community. Our rate structure makes it difficult for us to serve folks with challenging medical and behavior type issues. And so really their letter gets at the fact that we really need to overhaul our waiver system. And we need to look at a new way to improve the rates, improve the number of slots we provide, but then also put into place some crisis stabilization systems in all major localities to avoid putting more people in institutions. Right now, it's the hospitals and the police and other emergency personnel that are having to work with our population that has usually dual diagnosed with an intellectual disability and or mental health, and they are not equipped and trained to do that crisis stabilization. And so we as the private sector and the CSP system needs to come up with a better solution.
But as you said, there are states that have figured this out.
Absolutely.
Yeah.
There's 13 that I know of as of 2010. 13 of them.
Well, I will tell you, and we only have got a few more minutes, but I have a unique perspective in that I did work in a state institution here in Virginia, Southside Virginia Training Center, for about 3 years back in the 70s. So I have that experience and also have a community-based experience. So, I have my opinion, and I'll share it at some other time. But having only a few more minutes, I'd love to get you back on the show. This thing just broke yesterday in the paper. Wanted to at least tease the audience a little bit. What, in a couple of minute or less, Chip, what else could you say about kind of where we're going and what do we need to do?
This is probably the largest civil rights battle that is going to go down in Virginia for probably the first one in a while, and for a future to come. I mean, this is the one last group of people that really need us to stand up for their rights. They need choice. They need to have a life like yours in the community, essentially. I think how that's going to manifest itself, the Department of Justice letter is going to provide us the leverage to get the General Assembly to actually allocate more resources towards these individuals and the services that they need. We're going to see institutions start downsizing much faster, and we're just going to see that transition of a priority on institutionalization and segregation over to integration in the community. The jobs are going to flow with those folks, so it's not really a jobs thing. What we're going to see is we're going to be able to serve more people in a higher quality environment for less total expenditure at the state. So it's even going to help our state budget. So that's what's going to play out over the next maybe 2 to 5 years. I think you're going to see a complete overhaul in the waiver system.
Well, thank you, Chip, and I know we're kind of running out of time. I think we got another guest or another person that has called in. I don't know if we're going to be able to get to them or not, but Chip, I do appreciate it. I hope we can, in a couple of weeks, can get you in on the show, that we can devote more time to this issue, because I think it's again a worthy topic that we should be discussing. And you are eloquent in the way in which you describe it. It is a human rights issue, and some of our most vulnerable people, and that's the sign of a evolved society, is how it treats its most vulnerable citizens.
Absolutely. Well, thank you for the opportunity.
Okay, Chip, thanks.